Hey y'all, we're going to now talk about how to prime your tubing for peritoneal dialysis. So the supplies you'll need is you're going to need your entire system here, which has your Buretrol, has where your waste fluid is going to go, and then our lovely priming coil and the spikes. Please note, I'm going to open this for a second, these spikes are incorrect. So if you pull this spike for some reason out of your storage room, please go back and look for this lovely blue. As these are the ones that attach properly to our PD fluid bags. So just know that you pulled the incorrect one if you see the spike. So you'll need your set. You need a flexi cap, which is this big one here. And what it looks like on the inside is it looks like this. So that's your flexi cap. And then you're gonna need your mini cap. It comes in the smaller package. And it looks like this. So what you want to do first is, one of the best times to do this is after you filled your patient. So kind of in that time frame, you can work on priming, and then that way your first drain is the old fluid, and you actually are able to prime this portion. So your tubing that connects to the patient, you can prime that portion with the drain. One less priming step you have to do. So when you're priming, you want to get either a bedside table or bedside cart, either one. Wipe it down with purple wipes and let it dry. Please remember that this is a sterile procedure, so if you have signs, put your signs up, ask the parents to leave, and you do need to wear a sterile gown, gloves, hat, and mask. So what you'll do is you're gonna open up your packaging. You are going to then open up your caps and drop them onto your field, as this is sterile. These caps are also sterile. Those. Then you're going to want to put on your sterile gloves. I would keep several pairs of sterile gloves around, as you might have to switch them a couple times. I'm going to do good hand hygiene between. So when you're looking over here at your tubing, you want to go ahead and clamp all of your connector ports up at the top. You can also clamp right here at your Buretrol is another spot you want to clamp. You'll then work your way down. You want to double check that the roller clamp is also clamped as well. A lot of times this tubing is going to be really twisted inside, so you will have to untwist it a little bit. You untwist from your coil. The biggest part you want to make sure is that this end currently does not have a cap on it. So you want to make sure that you keep hold of that so it doesn't fly off your sterile field. So here, and then you can go ahead and put your flexi cap on, and that's going to make it sterile. And kind of protect that from, if it flies off the field, it's not going to be the end of the world. And then the last thing, so our waste catch here is always unlocked. So please make sure that you go in and lock it, or you're just going to spill fluid all over the floor, speaking from personal experience. So now that that's done, the next thing that you want to do is you're going to want to take your mini cap and you're going to go to your patient. So this one gets a little tricky. So I've always done it in my pinky. This blue piece right here locks. So once you've done your fill, it's great for you to lock, and you do it in the clockwise position. So righty-tighty. You will then disconnect the previous tubing, or if it's a new catheter, you'll take off the cap that they have on it. Fair warning, if you have a new catheter or you have a kiddo that's pause PD that's come back from surgery, please make sure that you attach a syringe and remove any of the heparin that might be in there, because we don't want to flush heparin into the patient. This is exactly like a Luer-Lock system, so our Luer-Lock syringes actually work on it. You'll want to, if you do have to do that, you'll clean really good with betadine, and then you'll pull back whatever the heparin amount that you were told that was left in the patient. Most of the time it's about 3.7, somewhere in that range. But you should have an order for heparin, and that should be passed along in a report how much heparin was put into the patient. So now that we've removed our heparin, we can secure the mini cap on. Both the mini cap and the flexi cap are impregnated with betadine, so this is going to clean your site while you're priming the rest of your tubing. So, and you can just leave that in the bed at this point. It's perfectly fine. So, now that you are back to your tubing, we've now dirtied our sterile gloves, so this is time that you'll switch your gloves. And we're going to move back to this back one so we can show you the appropriate connections. Okay. So now that you're sterile, what'll happen is you're going to take your spike and you're going to have it in one sterile hand. This tubing right here, when the bag comes, is going to have a pull tab on it. If I pull this out right now, it's going to flood fluid all over the floor. So you would pull the pull tab. I then hold here and will take my blue cap. You pull off this white here and you'll just twist to connect it. It's a luer lock system as well, so all you have to do is twist. The reason that we had you do all of the clamping is if you don't, once you crack this right here, this is how you get the fluid through. It'll crack this little blue piece. I'll put my hand behind it so you can see it. Fluid just goes through. So it's going to start filling your Buretrol, which you don't necessarily want to do quite yet. So you can crack that. You then can bring over the rest of your system. So we have the coil, which you're going to put in your lovely water warming pad. This is connected to another system that helps warm the water. It can be set at the highest degree. All we're doing is just making sure we're not putting cold fluid into the patient. And then you can always hook your waist catch here to the side. That way it's all kind of over by the patient. Then what I do is you're going to make sure your Buretrol is down. You're going to open your slide clamp here. I already have a pretty full Buretrol, but you're just going to let it fill all the way up. So we'll let that fill. What's going to happen is it's going to follow the path. It's going to fill all the way up. So once it's full, you then want to hang it up at the top with your non-sterile hand. And you're going to open your slide clamp. You also want to make sure that you clamp back your slide clamp. Since the Buretrol is up, gravity is your friend, so you're not going to get any more filling, but just remember to do it for peace of mind. So you're going to open this slide clamp. It's then going to work its way all the way down through the patient, or through the coil. You'll see it as it fills. So what I do at this point is, this will kind of still be on your sterile field just for ease of our video here. It was over here, but you can always use your glove like container, and you can put it over here so you have a spot to place your flexi cap and the end of your tubing. So I take my sterile hand. I then take my patient. You are going to untwist your mini cap and get rid of it. You'll take off your flexi cap and you're going to attach just like so. Twist system. Be nice to your friends. Secure it, but don't like crank it on there so it doesn't get stuck. At this point, you're still going to leave your blue, your actual transfer catheter locked, so please don't open up the blue yet. So now everything is sterile, so everything is connected, so you no longer have to be sterile, which is nice. So you'll let this work all the way through. What we're letting prime, how you have your stopcock. So do you see how it's off to my patient? We're following up to the patient. It's off. So really all we're doing right now is we're just letting all the tubing prime. So it's going to come through, go here, and then it's going to start to drain in here. I let this drain until I get about 5 above my actual fill amount. So if our fill was 20, I would let it drain to 25. That way you're ready to go for your next round. Once this has worked all the way through and you're at your fill volume, you're going to lock back your slide clamp here. And then you're going to drain your waste. So once it's time, let's say it's now time for your cycle to end, so you need to drain your patient. You're then going to turn it off to your prime fluid. So I'm going to turn it off here. And what's going to happen, I'm going to open this up here. So you're going to open your transfer catheter here. And the patient then should start draining any fluid. You might see betadine in there. Don't be alarmed. It's just from when we cleaned the site. You're going to let it drain, and that's how you prime the portion that goes to the patient. And that is how you prime your PD fluid.